My pleasure to kick us off for this third webinar in this series, jointly organized by Research Impact Canada and Universities Policy Engagement Network. We'll be talking with a fabulous panel today, all about establishing policy engagement and developing institutional memory in smaller organizations. And just to throw off script for a little minute, Justin, you and I put our heads together on this webinar series about 18 months ago, and we've now organized this three webinars, and this is our third. We'll have a chance for reflections at the end, but I just want to thank you for engaging, you and UPEN for engaging in this work with Research Impact Canada.
It's been our pleasure. It's been our pleasure, David. Thank you.
Excellent. So I am one of your hosts today, your host and moderator today. My name is David Phipps. I am a settler born in England to white parents. We emigrated to the land that some people call Canada when I was 2 years old. I live with my husband in Toronto, which is on the traditional territories of the Anishinaabeg Nation, the Haudenosaunee Confederacy, the Huron-Wendat, and the Métis. The current treaty holders are the Mississaugas of the Credit First Nation. I work at York University in Toronto as the Assistant Vice President, Research Strategy and Impact, and I'm the Network Director for Research Impact Canada. And I'd just like to turn it over to my co-moderator, Justin Fisher.
Hello, everyone. Very nice to see so many of you here, and thanks for coming to what I hope is a terrific webinar. So my name's Justin Fisher. I was born and raised and continue to live in London. I live with my wife. We've got 2 grown-up children now in their late 20s. I'm Professor of Political Science at Brunel University London and Director of Brunel Public Policy. And I'm a member of the UPEN International Subcommittee. And as David said, we've been working closely with Research Impact Canada to put these webinars together. And I hope it's the start of many, many more. So that's enough about me. Over to Iman.
Thank you, Justin. So in terms of housekeeping, there's a simultaneous interpretation for this webinar. Thank you so much for our interpreter, Michael May, who will be interpreting what we are saying here into French and a French channel. So if you prefer to listen to this webinar in French, then please go at the bottom of the bar of your screen on the interpretation button with an icon with a globe. You can select the French channel to listen to this webinar in French. We have also enabled closed captioning, where you will see English subtitles on the bottom of the screen, and you can access that by pressing on the live transcript button. If you have questions during this webinar, feel free to add them in the Q&A section, and our panelists and moderators will try to address them throughout the discussion. We will be recording this webinar, and yes, it will be made available on Research Impact Canada's website in about 3 weeks' time. And we also have with us today a live graphic recorder, Ashton Rodenheiser, who will be capturing our panelists' insights and converting them into an engaging visual that will be shared also at a later stage. So without further ado, let's introduce our panelists. Our first panelist with us today is Sarah Kipping. She's the Director of Professional Practice and Health Informant Management at Ontario Shores Centre for Mental Health Sciences. She's a master's prepared and Canadian Nurses Association certified psychiatric and mental health registered nurse, and has previously worked with specialized mental health programs as both a point of care clinicians and in advanced practice roles. Sarah is passionate about and dedicated to the advancement of mental health care, both through recovery-oriented practices and innovative approaches, including technology and population health strategies. She has presented widely and is a published author. Welcome, Sarah.
Thank you so much for that introduction. So I'm going to...
I'll continue also with Dr.
Sorry, I thought I was going. Okay, sorry. Thank you so much.
Dr. Julie Bayley is a Director of Research Impact Development at the University of Lincoln, Director of Lincoln Impact Literacy Institute, and a Chartered Health Psychologist. She collaborates internationally on the development of impact literacy and consults widely across the research sector, particularly with the National Institute of Health Research and Emerald Publishing. Julie is an honorary clinical associate professor at Nottingham University Hospitals. She's the policy leads for the British Psychology Society Division of Health Psychology and previous director of qualifications for the Association of Research Managers and Administrators. Outside of work, Julie is a dementia carer and vascular patient advocate. Welcome, Julie.
And thank you, Iman. Just before we throw it over to Sarah and then to Julie, Justin, any opening remarks that you would like to make?
Absolutely. So the reason we've chosen the topic for this webinar is that one of the joys of working in UPEN, and also for David in Research Impact Canada, is that it's very clear that fantastic research impact and policy engagement goes on across the sector, across larger institutions, smaller ones, and so on and so forth. In other words, research impact and policy engagement is not just about the Russell Group in the UK or the U15 in Canada. It happens in a wide range of different institutions. And what we wanted to do with today's session was look at some of the real achievements, but also some of the challenges of trying to establish more of this excellent work in institutions where perhaps there's less of a tradition of doing this. And as with all of the webinars, think about what lessons we can learn from each other. One of the great things about the past two webinars is I think we've been able to spread excellent practice from across both countries. So I hope you'll find this very, very engaging. What do we mean in the context of the UK by a smaller institution? Well, it's effectively one that's not part of the Russell Group. I think would be a good place to start, but also one that has a variety of missions, one of which might be teaching as a core part of its activity. And we want to also think about the challenges for building infrastructure to support policy impact, for example, where research activity across the institution may be uneven. So we're looking at the lessons learned from both of our excellent speakers about how we can build on what they do in their institutions, both in our, whether we're in smaller institutions ourselves or indeed in larger institutions. So those are the sort of key themes I think will come from today. David.
Excellent. Thank you, Justin. And reflecting on small can be mighty, and we are going to hear about this. I think it's important, a couple of moments for everyone on the call. So we are talking about research institutions, not just universities, because Sarah Kipping does work at Ontario Shores. She'll talk about Ontario Shores, but an institution that is highly committed to turning the research that they do into clinical practice outcomes for their patients and families in their practice. So just one note that this is not all about universities. It is about research performing organizations. For the Canadians on the call, you will hear some comments about the Research Excellence Framework, and that is a UK institutional assessment system where a portion of the score of the assessment is on the societal impacts of research. So you will hear that. We don't have that in Canada. Be thankful. Julie will agree with me on that one. But just, in terms of small, again, small being mighty, I think of small as the one research institution, one town model. So in Toronto, in Canada, we've got 4 universities and a dozen research hospitals and 3 or 4 colleges. But in Thunder Bay in Northern Ontario, they have 1. And the relationship between that university and the civic culture, the economic, social, and cultural fabric of the town is tightly interwoven. And so the small, air quotes, small institution, the relationship between a one town, one institution, one university model is where I think a lot of those strengths can lie. So I hope Justin will hear some of that modeling as well. So I will then turn it over to Iman to welcome our panelists in order.
David, I have already welcomed our panelists, so I guess we can start with Sarah.
Fantastic.
Yeah, Sarah, if you could share your slides, and we welcome your presentation.
Is everyone seeing my screen now?
Yes, that's great.
Okay, great. So I'm very happy to be here today and to share about Ontario Shores' experience. Am I changing? Okay, so here's a picture of, this is our small and mighty hospital in Whitby, Ontario. So we're a 346 bed specialty mental health hospital in Whitby. And I think even when you were just speaking to small but mighty, we're one of 4 specialty mental health hospitals in Ontario. The others would be Waypoint, Royal Ottawa, and KMH. And in hoping to expand our collective kind of influence or impact from the research space, the Royal Ottawa, Waypoint, and Ontario Shores all share one electronic health record. So trying to put that strength in the data and the research impact that we could collectively have. We see ourselves as leading in recovery, innovation. You'll see innovation woven throughout our strategic plans and our directions and how we look to approach our work. And we were the first hospital in Canada and the first mental health hospital in the world to achieve what's called HIMSS MRAM stage 7, which means we are a fully electronic integrated record, something that we're very proud of and that we use in our technology to also advance our research. And as a side note, it was very funny because we had what was called a code gray last night at 10 p.m. So our entire system went down. And then I was thinking, what is this webinar going to look like and where am I going to be doing this from? But we were back up and running this morning. So I was very happy to see that. And you can also see that we're the first non-university member of Research Impact Canada. And I'll discuss a little bit more how we're involved in contributing in that space too. So as Ontario Shores, we see ourselves as leading. We have a number of specialized treatments and populations. So we have forensics populations, geriatrics populations, adolescents, and advanced psychiatry focusing on schizophrenia. So that's some of our key areas of research, education, and advocacy. We're based in our values, our corporate values of excellence. I really wanted to highlight here innovation as well. So we're very much looking for research and creative approaches to advance mental health care. So that's where it kind of lives in our overall values for our organization. And for the first time this year, so our new strategic plan from 22 to 26, this is the first time that the strategic plan, the academic, and the research plan were combined into one overall strategy. So you can see that at the bottom, I don't know if you can see my cursor, but advancing our core strengths. We've integrated academics and applied research into everything that we do. So we really, being that small organization, not as much capacity for the bigger research studies, but really looking to apply what we're learning and see outcomes with our patients as soon as possible and have really applicable research studies. So as I move to the next slide, you can see how we really align our strategic goals. We're very much looking for partnerships in the work that we're doing, strategic partnerships. We know that we can't do all this alone, and we want to work together with those in the community and the province. So looking at shared step models and how we can evaluate and use technology to advance those types of models. The concept of bundled care or integrated care, I know there's the UK has done so much amazing work in this, and Ontario is advancing in terms of Ontario health teams and integrated population health models. So how can we be in that space and support the development and implementation of different pathways for different populations, and then test them and evaluate them. And then our third direction, again, using innovative technologies and solutions. So how can we partner with other research organizations to look at how we can have technology? We know our human health resources will only go so far, and technology can help advance the mental health care work that we're doing. So how can we look to include more technology in our work? You see this is about real-time data. So again, I don't know if I need to spend too much time on these slides, but it's just really showing you how we're embedding research into all of our strategic directions and plans. And then also advancing our workforce and how we can build capacity with our clinicians as specialized mental health clinicians through team-based models, and also through what we're calling micro-credential pursuits, which is in the academic space looking to create education and resources for our populations to increase their knowledge and capacity. One thing that we're very proud of in terms of research impact and knowledge mobilization is contributing to some of the knowledge mobilization curriculum for Mobilize U. So this is an 8-week program for helping to develop specialists and capacity within the organization for knowledge mobilization. We know we have a small research team here, so it's looking to expand our clinicians' capacity across the cluster in terms of how we can get that research to the front lines and to the front of care as much as we can. And we had the ability and the opportunity to present at the Research Impact annual general meeting. This is just some pictures just showing some of the involvement from some of our clinicians and team members. And you can see as we've developed these specialists in the hospital, they have been highlighted and just really known throughout the organization for the work that they're doing and where they're looking to bring knowledge to the care that we're providing and the work underway. So here's some examples of two of our clinicians that are helping to spread that impact. And I think when we speak to policy and impact, we're really looking at how we can impact policy at the healthcare level. So within our own organization, how we can help to lead specialized mental health policy within the province and hopefully nationally as well. So I think that that's where we lend in the healthcare space in terms of policy impact. You can see we have targets and results for the number of publications and the impact that we make in impact journals also. So we've been successful this year with 32 publications so far, and looking to continue to see how we can build and grow our knowledge translation participants and continue to take those studies that we have and bring them into the care that we provide. Another idea and a way that we're looking to move technology and innovation is through the idea and concept of a mental health accelerator. So really bringing together partners from the communities and collaborations. Again, I spoke to partnerships in terms of clinical care, but even partnering with other organizations or startups or innovation companies who have ideas that they either want to try, test, or apply in our setting. I spoke before about the integrated electronic health record that we have, and we see data as one of our key assets that we can bring to applying new technologies or to learning new ideas. So this is a kind of an example of collision spaces or kind of brainstorming and ways that we can think of new ways to deliver mental health care and what we can provide. So how might we do this? So we're looking at workshops, building our partnerships with investors and tech partners, and also creating a space. So the idea would be that we have a living lab here of technologies that can be brought in their different phases of design and applied in our population health in our setting to see what could work and what we can contribute further to the research that we're doing and the impact that we're having. So those are my slides, just kind of an idea of where we are for Ontario Shores in the hospital, and looking forward to the discussions and the questions after. So thank you.
Thank you very much, Sarah. I think we'll hold questions for now. And then we'll, Julie, if we could invite you to share your slides and to provide your presentation, we'll then have some questions from the audience and some panel discussion.
Okay. Thank you, David. Can I check you can hear me and see my slides?
Yes, on both fronts.
Thank you very much. Lovely to join you this morning or this afternoon, depending on your location. I'm presenting this on behalf of myself and Dr. Mark Bannister, who can't join us today, but they are a shared story of engagement and impact at the University of Lincoln. Just to start with a bit of kind of geographical scene setting, the University of Lincoln is on the eastern, well, Lincolnshire is on the eastern coast of the UK. You can see it there in the diagram. We do have a beautiful campus. The pictures do indeed do it justice. But you can see from our location there, we are partly a coastal region, but we're also very, very rural. Just to give you a sense of the region, it is very historic. We can trace the history of the region back to the Iron Age, the Roman settlement, and our cathedral was first built in 1072. So we have a kind of 3,000-year history that we can mark, and we have one of the only surviving copies of the Magna Carta, the foundational document for our kind of laws in the UK. We're rural and coastal, but crucially, part of our coastline communities are some of the most deprived areas of the country in terms of health, environment, employment, etc. So we have this beautiful region, but there are pockets of deprivation. The university is a pivotal part of this community. we were one of the first new build kind of city centre campuses for many, many years, opened in 1996 on a regenerated derelict railway site and built by the community. It was not a top-down government directive, it was built by our community, and we've been a university since 2001. We consist of 4 colleges, science, social science, arts and business, and we have a range of kind of focused units across those. We have grown fairly substantially across that time, and we're at around 16,000 or so students with a 9% international student body. Compare that to some of our Russell Group counterparts who are at about 40,000 students, just to give you a sense of scale. We have a lot of courses, undergraduate and postgraduate, across many, many topics. We are quite teaching active or teaching dominant with research activity. We're looking to change that towards being more research kind of focused. But we certainly satisfy the picture that David painted at the beginning, which was that a university located in its community and does have teaching as its primary mechanism. But we employ or we engage, and we have students from our region. We do have a real regional sense to our staff and our students, and we're very, very proud of that. Now, the focus of this webinar is around engagement and policy engagement in smaller institutions. And reflecting on that, I think there are a series of challenges which are not only felt by smaller institutions, but are perhaps more acutely felt by us. So we do have a real challenge with workload and capacity. Now, of course, the whole sector has an issue with that, but we are so teaching dominant, we have such pressures on our colleagues to deliver teaching that can have a real knock-on effect for time available and system allowing of time available to do engagement activities. And we do have fewer resources. We don't have a lot of pump priming. We don't have as much kind of block funding as other institutions will have. And that gives a natural cap on how much we can do institutionally. There is perhaps a knowledge and skills gap, not to suggest that our colleagues don't have the knowledge and skills, of course they do, but suggestive that the widespread development of those is capped, is limited by capacity. I think it's fair to say, and David mentioned the REF process earlier, we have created what I would say are accidental cultures around engagement. Who does engagement, who does impact, what counts? And we're needing to unpick a lot of that. And by definition, at our size, it is harder to compete at scale in big funding applications, in large scale impact. So there's a natural limitation just due to size. But we are doing a lot of things, and we're very proud of what we're doing. So I've just put on this screen a few headlines. And in the middle there, you can see the phrase transforming lives and communities. This is the headline for our new strategy. And it really speaks to our appetite for and our pride in working with our region as a smaller institution. But this is perhaps most clearly demonstrated in the Permeable University Manifesto, our previous VC developed around 2 or 3 years ago. And this is a call to the sector to say, don't just be kind of in the sector, don't just be part of the region, be working with, make your walls permeable, engage across, open your campus, open your doors so that engagement is true and it's both inward and outward. And that does feel to be something that we've kind of built into our DNA now. But you also see things like a lot of partnerships built to support our coastal communities and projects looking at things that really affect those communities, seaside towns with tourism and seasonal business. A huge amount of work goes into working with our agricultural partners. So we have a huge farming community, lots of rural businesses, smaller businesses who have particular needs which perhaps aren't shared by urban counterparts. So using the university as an engine of support for growth in those businesses. And then we have on the bottom some of our development. So we have the Lincoln Impact Literacy Institute, the institute I oversee. And really the headline here is, if we invest in people to understand what impact is, we can have more meaningful effects. We can lose the sense of burden of some of our agendas that we have to comply with. We can do it because it matters and we can do it well. So Lily is our strategic hub for impact with that pillar underneath it. The Lincoln Policy Hub, I'll come on to in a moment, but is a fairly recent development to support our policy work. And we also have the picture on the bottom right there is our new medical school. It's been in place a couple of years now. We're in partnership with another university, but what this testifies to is the benefit of working with our region, looking at government opportunities and saying, how can we help our community? In this case, it's training up doctors to then stay in the region. I mentioned the policy hub. We have not historically had a huge amount of funding available for some things around engagement, but there has been some government funding in support of policy engagement and policy impact, 2 of them listed there. We have been in receipt of that, which has been fantastic. What that has allowed us to do is put resources into policy engagement, which perhaps before were far more as and when. And working with our regional partners to support evidence-based policy making. The Lincoln Policy Hub is something that's come out of that funding. And this is an internal resource for our colleagues, but also operates externally. And it's allowed us to develop policy engagement capacity, training, development, and funding. And number 2 there, that we now have a policy fund, which we didn't have before, to support policy engagement initiatives. Unsurprisingly, there is a link to our REF impact case studies and supporting those. But it's more than that. It's about supporting our civic role, our kind of strategic priorities, and strengthening all of those things I've mentioned around engagement. There are, of course, challenges within this as well. We still have limited resources. It is a great scheme, but it's a small unit and it has a part-time director. Our teaching intensivity means we have time poor academics. So even though the opportunities are there, does not mean they can be taken up. We have uneven policy engagement across the university, some pockets of excellence and some who are still trying to understand what it looks like. And we don't have an institutional memory, particularly for some of these things. But that funding, which is not huge, but that funding has allowed us to target funds and add value on some of our research, to strengthen some of our partnerships, support impact, support capacity building, and change attitudes to policy engagement, which for many felt really was quite scary for some people actually. But it's also opened up opportunities working with UPEN and connecting with our external communities, which has been fantastic, and obviously helping to deliver on the university's strategic aims. And I suppose I just want to wrap up this talk with some lessons learned. So this is lessons learned, I think, from us as a smaller institution about how perhaps that learning could be translated. I would say absolutely connect with external networks. Now that's a little redundant perhaps, given that we're on a UPEN Research Impact Canada call, but it's absolutely a reinforcement to say, if you're in a smaller institution, connecting with peers externally is one of the single strongest things to do to uplift the expertise available. ARMA there is the Association of Research Managers and Administrators, which is the UK research management organisation. Beyond that, it's really principles I think I want to convey. If you're a smaller institution, engaging inwards and outwards, opening your doors, being permeable, builds up those connections that are organic and meaningful and can take you in a really strong direction. I would absolutely urge you to recognise competing pressures, teaching, income, outputs, all of those, because it's really easy to push on the positivity of engagement without recognising the pressure. So engage, not enrage is probably a top line there. I've suggested developing focused engine rooms. So we have our policy hub, we have Lily, we have other initiatives like that. Coordinating and driving things that matter with what you've got makes best use of the assets you have available. And then collaborating to share the load. That's internally with colleagues and externally as well. But recognizing there is a cap on our resources, use what you have, be focused. We have focus on agriculture, we have focus on rural health, not exclusively, we have more than that, but that focus gives us identity and gives us a really meaningful footprint. I said here, adapt processes to support, not block it, and be agile. We all know that systems can sometimes be slower than we want, but if you're a smaller organization, often it can mean your systems can be more agile, and if they can be, use that. And I think the final point is to celebrate who you are, be anchored. We are anchored in our region and we are proud of that. But whatever your kind of unique shape and size is, celebrate it and own it. Thank you very much.
Great. Thank you, Julie, and thank you, Sarah. It was great to hear from both of you. What we'll do is open it up to the audience for questions before we go into panel mode. And these will be questions first of specific questions of Julie or Sarah. And I'm going to start off by saying, Sarah, I haven't known about the Mental Health Innovation Accelerator. So that's very exciting. You're applying what we learned from entrepreneurship methods into the mental health model. So, collisions, hacks, and things like that. So that sounds very exciting. My question to you is, with the other 3 hospitals that are in your Ontario Mental Health Hospital Network, do you see them as a sort of built-in receptors for what comes out of your accelerators?
Great question. Yes, they would be scale to the other organizations as well in terms of how we can scale our new innovations. I think when I mentioned that we were in a cluster together, I forgot to mention that our documentation is standardized to about 92% of the documentation that we have. So I think when we talk about scaling, we want to make and that hopefully that is a reflection of our practices too, through the documentation system, but we can scale to other organizations. We all have specialty areas within our hospitals as well. So what that means to share with others. And as much as possible to do it together right from the beginning when we can. But yes, that's the goal, is to work together on these, and also to spread further beyond to the other specialized mental health beds that are throughout the province.
That's a very exciting structure with that cluster, to be able to have sort of built-in scale partners, right? To be able to then, you've tested within Ontario Shores, but then how might you test and look at the implementation of those within other contexts? Just before I throw it to Justin, see if he has a question, Connie or Iman, if participants have questions, how might they make those questions known?
They can add the questions on the Q&A sections, and you will be able to see it, both yourself and the panelists.
Great, thank you for that. And Justin, just before you go, I just wanted to draw attention to what Ashton is doing. I've never seen a graphic illustrator in a webinar before. So it's a wonderful opportunity. And if people can just scroll through and highlight what Ashton is doing, that's amazing. Justin, any questions of clarification or point for either Sarah or Julie?
Yeah, I have a question for Julie. So in your presentation, you stressed the role of the region a great deal, and Lincoln's work with the region. And I wonder if that's a sort of strategic decision to really maximize the benefits from the excellent research that's going on there. So do you do that to the exclusion of the national level of government, or just a lot more at the regional level?
It's been an interesting conversation we've had about that internally, because there are obviously drivers to do far more national, essentially ref schools well higher up. But what the balance, the strategic balance we've sought is we honour absolutely our civic commitment to our region. So we are definitely focused on supporting their growth, not at the expense of higher level policy. And where that factors in mostly is we will do work with our region like as a living lab to translate our messages upwards. So you'll typically find, not always, but typically find a lot of our researchers are working with our locality, not exclusively, but often, to translate the messages for other areas of the country and up to national policy. An example being our ambulance work, our pre-hospital work, a lot of that done in the East Midlands, but has become national and in some places international policy.
I mean, it's an interesting point you raised there, because it suggests that one kind of impact or policy engagement is somehow better than the other. And I would have thought in some ways that the deliverables in terms of improving people's lives are much more likely to be felt locally.
I would absolutely agree with you. And I think there is a natural tension in that of course, the reach of impact is not marked by its geography, and it's not marked by those things. However, there is a sense that local impact is not as big as national impact, and it's a battle we fight. I personally don't agree with that. I think the depth of the impact is the important thing, but there is something in conflict with where we are having this regional footprint with what we feel is the, shall we say, the competitive line that we need for other agendas. So it is a balance we're still seeking to strike. So we don't want to dishonor our region. We're built by them. So there's somewhere in there is a challenge for us.
Great, thank you, Julie. Jim has put a comment in the Q&A. Thank you, Jim. It's more for the panel than just for either one of you. So I think, Jim, we're going to hold that for the panel presentation. I've just got one more question for Julie. Specifically, is there, or what is the relationship between the Lincoln Impacts Literacy Institute, Lily, and the Lincoln Policy Hub? Are they connected? Do they work together at all?
Yes, absolutely. So so Lily is set up to be the kind of impact strategic hub, thinking about what impact we can have. The policy hub is set up to support policy engagement. Mark leads the policy hub. Mark and I routinely connect. So for example, if someone applies for funding to his policy pot, he and I will discuss what of that could have impact potential and how we could feed back. If it's not policy, could it be another pot of money that we could work with? So those kind of things. So we link together. It's quite organic at the moment, but we link so that we've got the policy strength and the impact strength put together.
Excellent. So Christine also has a good question in the Q&A for the panel. Iman, I wonder if you could also pin Sarah up so we have the four of us up. And then we'll go to the panel questions. And so this would be for both Julie and for Sarah to reflect on Jim's question. So Julie mentioned the lack of institutional memory. So how has the panel, how have you and Julie addressed that in your institutions? Sorry, you and Sarah addressed that in your institutions, noting that, and how might remote work have either complemented or enhance that? So the question is really on as people move and we lose institutional memory, what impact does that have on impact? So Julie first, and then Sarah.
So we have certainly felt the pain of a loss of institutional memory in things like ref case studies, because people left and we didn't have evidence and so forth. We have since set up far more kind of information management that holds a lot of that institutional memory, the evidence of engagement, the evidence of impact, etc. So part of the answer for us has been information management, but it's also about making sure that those conversations between academics and our research managers and so forth are far more frequent and far more routine, so we can capture a lot of that institutional memory.
Right. Sarah, do you see this in Ontario Shores with people, researchers or impact-related staff coming in and going out?
Absolutely. I think many of us know during even the pandemic, the healthcare setting has experienced even more than usual turnover. So it's definitely something that I see that we experience. When I think of institutional memory, I agree with Julie. We document every decision that is ever made, almost over document, but to the point of we know what question was asked, where we came to the decision, what evidence was used. We make sure it's all based on evidence and research practices, and then we can keep continuing to refer back to those, even as we've had some turnover or some different people join teams. I would actually say remote work was an enabler in some ways too, because it allowed us to make partnerships outside of our area that we might not have had access to previously, but it's not easy either to have remote work. We find relationships to be so key to community partnerships. So it's taking that time to build the relationships, and then turnover can affect that when you're trying to rebuild and have that place of trust in what you're doing. I was wearing my hat in terms of, obviously it's a lot of clinicians at the hospital here and not as many that are as experienced in research. So it's how to, Julie, I loved your comment about engage but not enrage. So it's how to make sure what we're doing, that the clinicians see the meaning, the value that it can bring, that they're excited. That's why we have people, involved in the accelerators or the brainstorming work, to make sure it's something that they're interested to, or they could see as something possible. So really bringing them in as much as possible and developing them with knowledge mobilization and translation.
And I can comment on the same question from the Research Impact Canada member institutions. As lead institution at York University, my university, in the early years, when we were 6 to 10 institutions, we worked with probably 20 different people because they kept turning over at other institutions, because this has not been hard money funded. It's been funded on soft money at our institutions. And so people are on term contracts and finished contracts and they leave. We're starting to see some shifts in that. It's not like in commercialization, like we were filing patents and doing industry collaborations. Those are hard money positions, right? The work in this more non-commercial space is really only starting to find defined offices. Justin, I think we have a second question in the chat.
We do, and it's one related in many ways to the first. It leads on really rather nicely. It's from Christine. And you've spoken about turnover and institutional memory within your own institutions. But one of the challenges for all organizations is staff turnover with the organizations with whom we collaborate, whether that's local government, civil service, local community organizations, etc. So how do you retain the partnership when key people move on? But also make sure that you're not reinventing the wheel every time a new person starts in one of your partner organizations. Who wants to kick off? Should we go with Julie, as you're not muted?
Yeah. And it is a huge challenge. We certainly felt that challenge a lot in REF. I mean, we had one case that basically fell down because the chief evidence giver got arrested. I mean, this is the level. All was well, but I think you're so reliant. You forget how reliant you are. I'm sorry, I've disrupted the proceedings. You forget how reliant you are on those partnerships. Now, we absolutely need to make sure those partnerships are supported, because it's the people bit that makes these things work. But I think what we're trying to do is make a more of an institutional link as well. So it's not just to that person, it's that person's team, their department, their boss, whatever that is. And where, if we really need to, we can go as far as contractually linking it. Say, dear institution, we ask to come back to you in 6 months and find out what you've done with this. Now, that could feel a little bit oversold, but I think anywhere between those two things, putting in something, a contact point beyond just those individuals is a key part of that.
Sarah?
I would absolutely agree. I know it seems like it's a lot of work, or kind of an area that you want to focus efforts, but I think we do a memorandum of understanding, just really documenting out what we're out to achieve together and making sure we're all clear and on the same page, project charters, regular status updates, just to make sure that we can keep that open and not have to reinvent the wheel or circle back on previous work. We do also make sure that we involve patients and families as much as possible through patient advisory councils, or as members of the research as co-investigators or on the teams, and hoping everyone can keep everyone in check together transparently what we're out to achieve. So I think that's another key piece for us as well.
I mean, actually, the point that David made previously about the work in universities and research organizations being built on soft money, I think that's also true with a lot of partner organizations, whether those are charities or particularly local authorities, so that the engagement will often be built on sort of goodwill and initiatives from key individuals. So there's important lessons to learn from there. So David, over to you. Other questions?
Yeah, thanks. I'll just take the moderator's privilege to actually provide some further input into the last question. We've had long-standing collaborations with well, in Canada, it's called a United Way organization, and this is sort of an association of community associations, and it raises funds for organizations, but builds civic muscle as well. And so our university and United Way have had a long-standing collaboration, and the CEO of United Way York Region said there should be no drive-by partnering. I.e., we need to create institutional collaborations. As Sarah said, is it an MOU? Is it a project charter? So that because people do change. But if we can have institution to institution collaborations, then that relationship will transcend as projects come in and come out. So it's a way of thinking of creating more sustainability and continuity as people come in and go out. We have the opportunity for more members of the participants in the webinar to ask questions in the Q&A. And while they're thinking of that, I want to ask Sarah and Julie to reflect on why small can be mighty. And I'm just going to reference some work of Jonathan Grant. He did this work after the 2014 Research Excellence Framework exercise, where he used word analysis on all the 6,797, Julie will correct me on the number, I don't know, it's almost 7,000 impact case studies. And he found that the smaller institutions punch above their weight for impact. So why, when you reflect on your role as a, air quotes, small institution, what's the secret ingredient that makes small also mighty? Sarah, what are your thoughts?
The first thought that it's a great question. The first thought that I think of is that we're boots on, like in terms of this hospital, it's boots on the ground right where the care is being provided. So I think when you have that opportunity to be that close to the front line, like to the care that's there, and then knowing what's possible, I think that that's a great opportunity to be connected to high impact work. I also think a smaller organization might have less bureaucratic levels, or just may be able to move things a bit faster than others. I think that we have our senior team very involved in some of the day-to-day activities and supporting those to move as well. So I think that might be two pieces from this hospital setting that enable its impact.
Right, and from the hospital setting, this is Julie's thinking about from the university setting. From the hospital setting, I know that you have in Ontario Shores deep, not relationships, engagement with patients and families.
Yeah.
And so you kind of got the end beneficiaries embedded right up front. Is that a recipe for success as well?
Absolutely. So we even in one example, we're designing like a clinical pathway across settings. So from acute care to specialized care to community, basing on the quality similar to the NICE guidelines in the UK. So basing on the quality standards in Ontario, and there's 14 statements you can implement. Clinicians have ones that they think are the most important, and it's never the same as to what could be the most important for patients and families. So having that balance, having that voice, and seeing what can be successful together, it's very influential and meaningful to make things successful.
Julie, Lincoln, small and mighty, why?
My answer is going to mirror absolutely what Sarah's just said around, the on the ground. Excuse me. We are by definition so close to our region and our community that we're not going out to look for what the problems are. We're already in dialogue to find out how we can help, and supporting the community and supporting that kind of regeneration and so forth. And yeah, I think the tiers of bureaucracy, they're always going to be there, but there does seem to be leadership that is closer and more accessible than perhaps in bigger universities with far more tiers of bureaucracy. I think the other thing that really supports this is we have an absolute appetite to partner. And perhaps this is because our capacity is low, we know we need to partner, but there feels less territorialism. Perhaps that's not the right word, but there's something which seeds the let's work on this together. We know who we are. We know what we bring to the party. Let's work with others, rather than a sense of protection and kind of closing ourselves off. And I'm not suggesting big universities necessarily do that, but I feel that appetite for partnership perhaps more in a smaller institution.
Great. And Justin, before I throw it to you, this is maybe if Ashton can get this in. Julie said tiers of bureaucracy, T-I-E-R-S. I heard tears, T-E-A-R-S, tears of bureaucracy.
Interpret as you wish.
So Ashton, I don't know if you can get tears as in levels of bureaucracy to be visually connected to tears as in the crying feelings we get when we deal with our own internal bureaucracies. Good on that, Ashton. We'll see what you come up with. Justin.
Great, thank you, David. So as we come towards the end of our webinar, I always think it's nice to reflect on your big wins in terms of policy and research impact, but also if you had one lesson you'd like to share that everybody could benefit from, that would be great. It could be something that went wrong, where you put it right and made something a lot better. I really don't mind which it is, but what's the thing you're most proud of, and what's the key lesson that you want people to take away from today? So Sarah, would you like to start?
Yeah, I think one of the things that we're most proud of, I've spoken a lot about technology and mental health, and sometimes those two can even have tension or competing kind of ideas as to how to move and advance mental health care. We were one of the first to implement a patient portal, so really looking at patient engagement and activation in their care, and publishing that and seeing the impact that having access, open access, and being central to people's care, what difference that made for the people that were involved. And so we have been very proud to support hospitals across the province and in the country in terms of advancing, removing that stigma and looking at mental health care and how we can improve it together. So we're very proud of that. I guess I would say lessons learned, like just keep challenging the status quo. I think it's there's lots we can do in terms of, asking questions. We always put that what if in front, so kind of trying to remove that what if, test safely, of course, but really trying to push the boundaries of what we can do together. That's been really key for us in terms of moving our work.
Great stuff. Julie.
There's so many things to be proud of, and there's some big ticket things, changing ambulance pre-hospital guidance on care packages, changing indicators, our NICE guidance. There's all sorts of things there, and in our agricultural work, work around robotics and all sorts of things. There's many big ticket items, but I suppose the other thing I want to say is things we are most proud of are what looks smaller. Kind of, we have a lot of migrant communities, making sure they have a voice, making sure that our communities can access healthcare they couldn't before. So I think I'm proud of the big ticket things, and our colleagues should be, but I'm also proud of those, what some would call smaller, but more meaningful impacts where somebody has been, they've felt the benefit in a really strong way. And I think that the lesson, and absolutely agree with Sarah's message, lesson for us is to not just be a partner in the delivery of the research or the impact we have in the agricultural work. Some of our impact was supporting our regional partners in responding to the COVID crisis and migrant labour and so forth. And it's staying in the relationship. That's kind of the biggest lesson, which is don't just go in, do the stuff and get out. This is a long-term thing. This is a partnership. It's a true relationship. And when times become tough, that's when it really shows. So stay in the relationship.
Great. Thank you so much, Julie. Before we do thank and head off, I wonder, Iman, if you could unpin all of us, and if you could pin up Ashton. I would love Ashton to zoom out and see a bit more of the work that they've been doing. You don't need my face. There we go. Oh, so Ashton, that's and look, I will note that the Tiers of Tears is on the right-hand side, just under where Ashton is drawing right now. The blue tears with a light blue tear inside it. So Ashton, well done on you. We've got the University of Lincoln, Ontario Shores in there. Justin, what are you seeing in this image?
I'm bowled over. This is fantastic. And it really sums up the key things that we've talked about, and also the importance of the engagement with local communities and the way in which all of our institutions can have policy impact and research impact in a whole range of different ways. I mean, I said at the start, one of the best things about working with UPEN is seeing what goes on at other institutions. And it's sessions like today where you really learn about the great work that's going on everywhere and where we can all learn from each other. A lot of the things that Julie and Sarah described, I think, are common to a whole range of institutions. And David, you made the point about soft money. This is where the ref can benefit you, actually, because hard money comes at the end of it. So you may wish for the ref at some point in time.
So Justin, if I could invite you to send us on our way, and while Justin is giving our closing remarks, Iman, could you please put the links to the two previous UPEN RIC webinars into the chat?
Great, thank you, David. So as we said at the start, this is the last of our current three-part series of co-hosted webinars between UPEN and Research Impact Canada. We hope you've enjoyed all of them, and we hope that there'll be many more. I think it's true that everybody who's attended these and both our respective organisations have learned a great deal from the fabulous speakers we've had today and also in the previous webinars. You can check out the first two on the Research Impact Canada website. The first one we co-hosted was Engaging with Government and Parliament and lessons there. And the second one was Policy and Societal Impact as an Institutional Mission. So I really hope you've enjoyed today. I hope you'll take a look at our other webinars if you haven't seen them already, and do look out for what we hope will be lots of other activities in the coming months. David, any final words from you?
No, nothing from me. Just thank you, Justin. It's been a pleasure over these three webinars, and I wish everyone to have an amazing rest of their day. Thank you.
Cheerio, everyone.